Hello, my name is Samantha Westrop and I'm a Public Health Specialty Registrar. I'm going to spend the next few minutes explaining the Immunisation Evaluation Framework tool that has been developed to help facilitate evaluation of local immunisation interventions. The tool was designed with a view that it would be used prospectively from the start of the planning of an intervention right through to the implementation and then resulting evaluation. However, we recognise that often evaluation is not approached at the start of the process, and so the tool can be completed retrospectively. As you can see from the screen here, the tool's been designed in a Microsoft Excel workbook with a number of tabs along the bottom. Each of them are labelled sequentially with a view that the user will start at number 1 and work their way through. I should add that the tool comes along with the Immunisation Evaluation Framework explanatory notes document. So although there are some explanatory notes in the left-hand side of the form here, if anything is unclear or you're looking for some more information about certain criteria, this is likely to be found in the Evaluation Framework explanatory notes. It's quite a comprehensive document. There are also some links to additional materials that may be useful as well, included in that documentation. So I have an example that I'm going to be using to populate this form to walk you through the process. That was kindly provided by a member of the working group. So each one of these tabs is designed with criteria specified and then areas for the user to fill in. If the user was to inadvertently click on one of the cells that's not meant to be completed and start to type, this error message will pop up because the sheet is protected. This is mainly because there's a number of formulas and macros working behind the scenes with this workbook. So rather than the user inadvertently breaking those formulas, we've chosen to lock the workbook. So only the cells that you are required to fill in will be able to be completed. So if we start with the first criteria, what is the problem you have identified and are seeking to address? So as I just mentioned, the view is that the user would be completing this prospectively, as this tab in particular will aid the user in designing the intervention itself. That being said, it can of course be completed retrospectively as well. So as you work your way through the designing tab, we are now asked what behaviour would need to change in order for the intervention to meet the aim. So I'm going to go through and populate with the working example that we have. Now, as I'm sure you can tell, I'm copying and pasting this from another document. But in reality, the user will be typing it in. So just to demonstrate that, I've just typed in the words there, example motivation. So we're working our way through. The designing tab of the workbook centers around the COM-B model. So COM-B includes capabilities, opportunities and motivation. And then the B part of the acronym is the behaviour that you wish to change. Now this model was selected because of the work of the WHO in the tailoring immunisation programmes. It's been optimised for use in immunisation interventions by the WHO. And so we thought it was a good model to use for local interventions in the UK. So now that we've completed this designing tab, we are then, and I should add that there are 6 fields for each area. It's not necessary to complete all 6 fields. So you're likely to have some spaces left. Now, once you've completed this tab with all of the details, you can then move on to the next tab, which is Combi Model Figure. So this was included as we thought it may be particularly useful for either internal or external presentations. It's a good visualization of the Combi model, and it could help those working in the intervention to really visualize what the intervention seeks to address, what behaviour in the centre here, and then each of the parts of the Combi model that feed into that behavioural change.